you go through mourning stages again once it comes to the anniversary of the death of your loved one. So
it really is important to do regular check-ins with yourself mentally.
You know, the more you are thinking negative things, the more negative outcomes you will have automatically.
Perspective, self-care for me takes place more from the inside outward. So those beautiful treatments and treatments that you give yourself is actually just basically the trimming for the journey that you take from inside towards the outside. So when you
Hi everyone, my name is Tanya Boyson and welcome to our 13th episode of the Come Up series. I am here with my lovely co-host, Luandra Jacobs, and our guests today are fellow YouTuber Eileen Bawe and our wellness coach, Tashlin Jenkins. And today we're going to be diving into self-care and why self-care is important. Over to you, Luandra.
Thank you, ladies, and welcome. So self-care is very important, is a very important topic these days, especially taking care of our mental health. The fact is that we all survived the pandemic and it has left us with some sort of trauma, right? So we live in a world where we are living according to people's judgment, especially through social media, isn't it? So it's very, very important to take care of ourselves mentally and otherwise. Yes. So Tanya, please ask your first question to our guest.
Okay, first of all, I would like to say thank you to Tashlin and Eileen for joining our show. And what do you do for self-care, and can you please tell us more about yourself? So we will start with Irene.
Hi guys, I am Irene Amanda Bawe and I am all the way from Namibia. So I feel so blessed and honored and grateful to be here with Tanya and Luandra and Tasha. So for me, self-care is basically putting yourself first and taking care of yourself. I think this year, or was it last year? Yeah, last year, ever since COVID, everything was just so chaotic and makar and everything. And we had lots of losses and we lost family members and friends and all that. And somehow, I think I mentioned it also yesterday to somebody else when we were having a conversation. Ever since COVID, so many people has pulled back and they are not so forthcoming and open. Everybody just wants to be on their own and do their own thing and stay out of that circle, and because you never know when something's going to happen or hit again. And that basically for me, especially this year, also I did it before. It's something once you come into a routine and you think, this so long, let me try something else, or let me leave that and just try and go on with my life. But it's never really about that. And once you let go of that routine, or you feel your body will tell you, listen here, woman, you're not taking care of me, so I'm starting to give you hints and do this, and that's where all the aches and pains and all those things are coming from. So self-care for me is, I've been on my hair growth journey now for I think about a few months, doing my skin routine on my face. I try to do all these things myself because since COVID, a lot of things has happened. Everything is just rising, prices is going up. So I try myself to do everything myself. I do my eyebrows myself, my face myself, my hair myself, my nails, and all that skincare and nice things. Just doing it yourself will make you just love yourself a little bit more, and you will realize once you take care of your body will take care of you.
Right. That's so nice. Tashlin?
I would just like to echo what Irene has said in terms of loving on yourself. And from an emotional, psychological perspective, self-care for me has unfolded in a way that hasn't been done before. So it's new patterns that I'm learning about myself. So honoring yourself in that space by putting yourself first, understanding what your boundaries are, what you're going to allow, what is good for you, and what takes away from you. So these situations can be perpetuated anywhere, at work, with family, at school, realizing where you stand in a situation and understanding what you allow. So from a psychological perspective, self-care for me takes place more from the inside outward. So those beautiful treatments and treatments that you give yourself is actually just basically the trimming for the journey that you take from inside towards the outside. So when you treat yourself better from your first thought and how you speak to yourself, you will then evolve to treat yourself better to the outside.
Wonderful. Well said. So Tasha, the next question is for you. There's a stigma around therapy, right? That it's only for people that are seriously mentally ill. Please describe what is therapy and the importance of therapy, because to my understanding, anyone can go for therapy.
No, absolutely. So therapy or psychotherapy was a term that was coined from Sigmund Freud, who is the father of psychology. And what he conceptualized was that a therapist or a psychologist will then sit with a patient, and then they would then essentially take the bits and bobs apart of your life. So you lay your life out on a plane so that you can start to discuss what exactly is your emotions, what you are thinking cognitively, and how this affects each other, because it does go in a cycle, they feed each other. The stigma around therapy, and I would like to use an analogy of a car,
Yeah.
because a car is something that people understand needs maintenance at regular intervals, and it needs something like oil and fuel to go. And sometimes we don't think of ourselves as that kind of organism or that kind of structure, a car.
Mm.
So mental health, because that's what we're trying to keep up. We're trying to keep up our mental health before it becomes mental illness.
Yes.
Um,
Yeah.
so we go for therapy sessions or counseling sessions, which is essential. I mean, we do it with our friends on a very superficial basis, but I really think a person should delve deeper and admit that life is full of pressures. And we need counseling. We need to debrief, because there's trauma upon trauma that we experience, whether they're small traumas or the larger ones. And we need that time and that space to actually unleash what is building up, the tension that's building up inside. So the analogy of the car, you will then go from here to your service center, to a therapist, a counseling, a coach, a wellness coach, and you'll sit and discuss, listen, I am hurting. This has hurt me, or that has been a problem in my life. This is my obstacle. And you take it as a plan. So then we will work out a plan to then put you on a journey to help you cultivate better coping mechanisms, because the life does squeeze you, life does pressure you. So the thing is to actually have positive coping mechanisms so you can handle life much better.
Mm.
Love it. I really love that explanation, and it's very true. And we have to look on the inside and actually find the root of what's happening and what's going on.
Mm.
Because, like you said, we speak with our friends, but we don't actually really speak about what's happening inside and what's really causing our thoughts.
Mhm.
But I really love that explanation, because a lot of people have a stigma on therapy, and I think after COVID, we actually have to also look at therapy as a good thing and not a bad thing at all.
Absolutely. I agree.
Irene, this question is for you. So, self care is about improving one's health. Have you ever gotten into a situation where you did not practice self care on yourself? And what steps did you take when you realize, okay, I'm neglecting myself. I need to look after myself now?
Yes, of course, so many times. The one in particular that I can share with you guys was last year. Last year, December, I caught COVID, and then my husband and everybody in the house had COVID. And after that, everything has just been so haywire and confusing and deurmekaar and everything. And the year before, with all the losses we had in the family and friends and all that, so obviously that routine that you had for your self-care, that fell away, because now you were trying to cope with emotions and other people's emotions and the loss of a family member or a friend and all that. And in January, in January, I was still not recovering, or I still had these post-COVID symptoms and whatever. But above all of that, then I went to the doctor, and then first it was my eyes, and then I went to the doctor, and he said, "No, I can't help you. It's something else. We need to find the root cause and all that." And I actually lost 30% in my right eye. And
Sure.
because I had that signs, I had it before 2019, the sign came and it went. Last year, November, it came and it went. December, it came and it went. I never really paid attention to it. I just thought, it's, a normal eye infection, and yeah, just fix it now temporarily and move on with my life. And because of that, I lost 30% vision in this eye. And it was not just an infection, it was something from my disease, that was because I wasn't paying attention or treating this disease. So obviously, it was now trying to attack the other organs of my body.
Sure.
And yeah, so then I've been with a specialist every single month this year. I'm drinking thousands, or not thousands, maybe hundreds of medication every single month, every single day. And that was just because I didn't pay attention to my body before. I didn't self-care, I didn't self-love. And yes, I knew the problem was there. And when it came up, I just temporarily fixed it, and then I moved on with my life. I didn't pay attention. So yeah, so now, since I've been in hospital twice again this year, and then I realized, no, it's time to move back and pay attention to myself, give my body what it needs, because I've been neglecting to take care of myself. And that's where I started, doing this and taking care of this. And like Tasha Lee also said earlier, mental health. Mental health was also a very big thing for me this year, where my specialist told me, we're going to get you a therapist to talk to. And yeah, I went to a few sessions, and because everything that happens to you in your body, it affects your brain, your mind. You're thinking all these wrong things. And, you know, the more you are thinking negative things, the more negative outcomes you will have automatically. And that is where mental health also comes in. So it's not just about people that you think are crazy or whatever. No, I'm not crazy, but I had to go see a therapist to help me get my mind straight, because otherwise depression will attack and all that. But positive thinking is part of it. It is really a part of it. And I'm back on my journey where I'm taking care of myself mentally, physically, emotionally, and positively.
Wow,
I
well
hope
done
that
for that.
answers you.
Yeah. Well done with getting back onto your self-care journey. Hey, like it really is important to do regular check-ins with yourself mentally. Yeah.
No, it is. It is very important. And if you don't do it, nobody else is going to do it for you. And
Yeah.
if you're not going to speak up and say, I need help or guidance, then nobody will know. And that will just build up and build up and build up. And later on, sometimes it's going to be, you know, too late. But it's never too late to start with something, or, you know, just do it. Just take the first step. That's the most important thing, I would say.
Yes. So Teshlan, let me bring you back into the conversation here. So due to the high suicidal states, right, everyone is encouraging people to be vulnerable and open up and communicate. All good and well. But how should people start, and with who should people talk to in this judgmental society?
Okay, I definitely have a few step plans, whatever you call it, 12-step plan.
Okay.
I talk to kids about where they are in their school environment. Children can find a person they can trust, maybe a counselor at school, a nurse, a teacher that they can trust. Obviously, in society, people are changing so much because the value of society is changing, the direction of society is changing. But once you can identify someone that can offer you a safe space to speak to, really reveal your true feelings to, that is a good start for you to seek help. Now, in a lot of families and structures at school, maybe it is not as safe. And then I would usually recommend people use lines like the SADC helpline, where you can call them, where they have an amazing network of professionals that can assist you, or they can use the Lifeline number. I can give you these numbers later on,
Okay.
where people can reach out to trained counselors on the phone, which will also then put you through and escalate you to some sort of help, whether it is psychologists or state hospitals, those kind of people that can assist.
Wonderful. Thank you for
I
that.
know. So actually, that was actually one of my questions. Who can people contact? Free toll line. Is that a free toll line for a therapist?
It is a toll-free line. For SADC, they will not necessarily give you a therapist online. However, there is a beautiful network, so they will refer you further. So for your general trauma responses, grief counseling, rape crisis, those kind of things, we generally used to refer to Lifeline. It's a sister network. The number, if I can remember, is 0861 322 322. So that one is toll-free, and you can get assistance in all those different situations, those traumatic situations. They are wonderful. I mean, I've worked with SADC for the past year. I had to change my projects a bit, but it's an amazing service. So SADC's website and contact details are on their website. So you will just then go on to www.sadag, which is sadag.co.za.
Okay, thank you very much for that, because there's a lot of people that I talk to ever since the pandemic. It's been really hard on them, especially those that have lost both their parents or their mom and their dad. And it's like so difficult to still cope. And you get people that just basically, as Irene said before, everybody's like to themselves, like they just
Retreat.
disappear like for a month, 2 months, and then they're like off social media, and then they're back again. They're like, no, I'm fine. But you're not actually fine, because you're not really dealing with your pain and your loss. And I mean, it's about 2 years or a year now, and then you still have to go through, it's like you go through mourning stages again once it comes to the anniversary of the death of your loved one. So it's just, I think that is just needed to reach out for help. And thank you for giving us that numbers and where people can just reach out and deal and talk about what's really actually going on. My other question is, if people are not looking for like therapists, but just like for a life coach, I'm not sure if you can help with that. Where can they get like or research for someone that can just be a life coach in terms of their next step of what they want to do in their career or business wise, etc.?
So I'm not so well versed in the life coaching sphere. I do understand that it is a growing sphere in coaching and wellness as well. What I can advise people is to just climb onto Google. I'm sure we have structures in terms of life coaching, and I think it would be a really good opportunity. And I would definitely advise some of my colleagues in the field that life coaching is essential at any stage of life. I really think, whether it is children, teenagers, young adults, especially because we go through our 20s with a blindfold on, and it's usually trial
Yeah.
and error. But yeah, to have life coaching, I think Google can offer some services. Like I said, I'm not too well versed in terms of that field, but it is an ever growing field, and I look forward to seeing what it would look like in the next 3 to 5 years.
Oh, nice. Okay, thank you very much for sharing your stories, especially Irene as well. Like it's amazing, and I'm sure people will relate to your experiences and take into the pointers as well as Tasha has given us. And please, if you're going through a tough time, please seek help. Talk to your loved ones. Talk to someone that you feel comfortable talking to. And that's all for me, Luandra.
Yes, thank you so much, ladies, for joining in today's conversation and sharing some of your good nuggets. Guys, I will link all the contact information that Teshlin has mentioned in the next slide. Yes, thank you for watching this episode. Please like, comment, and subscribe.